Welcome back. It was back to school today for most students in Saskatchewan, but many families will keep kids home because they're sick. Whether it's respiratory or gastro, several illnesses are sending children to the doctor, even to the hospital. Dr. Molly Brindamore is a pediatrician in Saskatoon, and she joins me now. Thanks for being here.
Thank you for having me. Hello.
Dr. Brindamore, what illnesses are you seeing the most in children right now?
What we're seeing the most is respiratory illnesses, what we call bronchiolitis. So it's viruses, and there's a huge variety of them, try causing difficulties breathing, particularly in kids less than 5. So in December, we had lots of troubles with influenza, as I'm sure you know. This has subsided somewhat, and then now we see RSV coming back with a force, but also rhinovirus, metapneumovirus, all sorts of respiratory viruses, which makes babies in particular quite a high risk of hospitalization.
Are you dealing with more severe cases, and if so, why?
That's a good question. I think the answer is a little bit complicated. We're seeing a lot more volume than we usually see, although January is usually peak respiratory season, but it is more busy than usual. And of course, if we see more volume, then the more severe cases will go with that as well. So I would say that, yes, we are seeing more severe cases and kids needing, intensive care, more support than usual. But that might be due to the volume of kids who are sick.
There might be parents watching this with sick kids wondering, what's the threshold? So what kind of cases require hospitalization? When should you go?
Yes. So my answer to this is, if you're worried, we'll always be happy to see you in the emergency department. Don't wait at home wondering if you should go or not. Usually, if you're wondering if you should go, that's probably a sign that you should. But of course, a baby or a child who's struggling to breathe so much that he can't feed appropriately, doesn't pee their usual amount, has a fever that's prolonged, like let's say more than 3 to 5 days of fever, they should probably get checked out, or they're too tired, too lethargic to start feeding. Then those would all be reasons to come in. And a child we call that work of breathing. So if they are breathing a lot faster than usual, or we see the skin in between their ribs sucking in when they're breathing, those are signs that the child should be assessed.
What kind of pressure are these hospitalizations of children placing on the healthcare system that maybe we haven't seen before?
So the hospitals are full, and we have the same number of rooms and the same number of staff that we do in usual time. And so kids are waiting a long time in the emergency department for a bed to free itself in the hospital. And we're seeing kids wait and emerge for 16, 18 hours overnight, which we haven't seen in previous years. And usually we always have like a bed here and there that we can fill, but now we're, at capacity. And then, what I've seen in the past few days is that we're even starting to think about, redistributing material across the province and saying, are we going to run out of more intensive support like high flow or ventilators? We haven't, but we're starting thinking about that as well, and kind of choosing really wisely how we start it and how we wean it, etc.
What kind of stress does that put on you as a healthcare provider, having to think that far ahead while also managing this extraordinary caseload?
It's difficult. My colleagues are tired, and nurses are tired as well. For example, today I was on call at the beginning of the week, and then someone took over, but I was called back because the ward is too busy for a single person to handle. It's just not safe. So it's really all hands on deck, and we're doing it because that's our job, and we want kids to be looked after and safe, and our colleagues to feel supported. But it's not sustainable to go on like this for months and months.
With kids being back at school, we know how the germs spread in schools. What can families do to protect themselves or others?
Yes, that's a very good question. So vaccines, of course, we talk a lot about vaccines. The flu vaccine is still available. The COVID vaccine is still available. Please go get immunized. You might still get sick, but you might not get admitted or get severe complications. So this is a very important thing. And then staying home when you're sick to decrease transmission. Of course, I think people have been generally very good about doing that, and I would encourage them to continue to do that. I know as a working mother that, it's hard to keep on working and having kids at home who potentially might be sick. And then, of course, mask wearing, it works. It works to decrease transmission and maybe prevent a few illness in children. And good old hand washing and cough etiquette, etc., works as well. But those are simple measures.
Thank you so much for making time for us today.
Thank you so much for having me.